We are extremely thrilled to have with us today Zaneta Adams, who is the director of the Michigan Veterans Affairs Agency, who was appointed by Governor Gretchen Whitmer just June of this year. So this is Director Adams' first time here at the Veterans Summit in Western Wayne County. She served 8 years in the U.S. Army, National Guard, and Reserve. She's a lawyer. Don't hold that against her. Did I forget to mention I'm a lawyer? And I always do, so that you guys don't hold that against me. But she has a deep commitment to helping veterans. She did that as a lawyer. She also has done this, as I say, as a member of the service, so she knows from which she speaks. She has degrees in psychology from Columbia College and a law degree from Western Michigan Cooley Law School.
I'm so pleased to be here to be able to present to you all, to talk about things that are dealing with health. And I think when we're talking about health, we're talking about health and wellness as well. And I would say that a lot that we do at the agency encompasses that. You all have read and heard a little bit about my bio, so I'm going to skip that a little bit. But I will just go into a little bit more detail on my bio. So I served 8 years between the Army, National Guard, and Army Reserve. And in 2005, I was in IRR, you know, that time when they say you're not going to get called up. It's just those 2 years, and you kind of skate through. Well, I was put on orders to basically go to Iraq or go to jail. So I was put on orders during that time. I left behind my husband, who was also a veteran, and my 3 children at the time, and went over to Fort Stewart, Georgia to prepare to go to Iraq. And during that time, we were doing a combat training, and I did a rapid dismount from a deuce and a half with the rails up and fell about 11 feet and severely injured my back. I had about 2 surgeries. I say about because I've had so many surgeries. I can't recall. 2 back surgeries. And I was left with the severed nerve and told I may never walk again. I was in a wheelchair for a little bit of time. So that was a devastating time for me. Went through depression, thoughts of suicide, just that whole gamut to try to pull myself back out of where I was. And the position that I hold right now at the Michigan Veterans Affairs Agency is very important to me, and it's very critical to me because during that time where I was dealing with my injury and disability from the military, I didn't have a lot of resources and support available that I could find readily at my fingertips. And so trying to navigate that process, trying to get my VA benefits and apply for those things was difficult. And as some of you all have probably experienced, when you're dealing with pain and you're dealing with disability, it's very hard to focus on what you need to focus on to get the job done. So I went through that period. I was able to get out of that. Part of me healing is I went back to school, got my law degree, and began practicing and started helping veterans get their compensation and pension benefits. So I did that for about the last 3.5 years. And during that time, I also started a women veterans nonprofit, Wink for All Women Veterans. And I did that to help women to acclimate back into civilian world and to have a support system when they got out. So that's kind of a little bit about how I got to this point today and why I'm so passionate about what I do, because I've lived that experience. So I know you don't really want to hear all about my life. I will tell you that I have 5 children, which includes 2 sets of twins. That's how you get to that number really quickly. And so I have double trouble twice. But so I can multitask, right? I have 5 kids. So we'll talk about a little bit about what we're doing at the state level. I've been in the position for about 3 months, so I learned the phrase drinking from a water hose, and I can definitely understand why that phrase has meaning, because that's what I feel like I'm doing with all the different programs and all the different things that I'm learning about here in the state of Michigan that I didn't know about prior to that. So what we're looking right now as a state agency, as you know, Michigan Veterans Affairs Agency was stood up in 2013, and it was kind of pulled out of the Department of Military Veterans Affairs, but we still fall under that department. And so, and the homes right now, under statute, they're actually kind of pulled out of the Michigan Veterans Affairs Agency by statute right now. We're about to hire an executive director, and so once that transition takes place, the homes will still be under the Department of Military and Veterans Affairs. It will not be housed within the Michigan Veterans Affairs Agency. So that's important just to know contact-wise and who to contact, because there is a facility board right now that manages those homes. So right now we're looking at having 7 homes in the state. That's our goal, is to, by the time we have everything all said and done and all the funding, that we can have 7 homes in the state in the next, hopefully, 10 to 20 years. Currently, what we're doing is we are building a brand new home in Chesterfield Township, which is in Macomb County, and this picture was probably taken about 2 weeks ago, so we have more walls and things up. So if you ever have an opportunity to drive by and head to Chesterfield Township, it's not far off the expressway, to be able to see this home. It's very exciting. Those homes are going to be individual homes. They will be CMS certified as well as obviously VA certified, and the criteria will remain the same. So we're opening that home, and we're still on schedule to open in 2021. We also are replacing the Grand Rapids Veterans Home. So we're looking at repurposing that, but that Grand Rapids Veterans Home, it's on the same schedule actually as the Chesterfield Township home. So we're looking to build that and increase the number of beds that we have here in the state of Michigan, so that people have choices. They don't have to just drive all the way up to the UP, or they don't have to just drive to Grand Rapids. I know the question's probably already brewing. Where are we going to have all those 7? We don't know yet. So we have kind of a list, but that list may change. I know that we want to have one in the Detroit area. We want to have probably another one in the northern Michigan area. But we don't have all of those finalized list as to where all 7 are going to be. We can tell you right now where the next 2 are going to be. So if you look at this rendering of a picture, this is kind of what it'll look like. There'll be 4 different housing areas where each veteran will have an individual room. So it'll be their private, it'll be a home. It won't be a facility or a nursing facility as it's normally, as you normally see. It won't look like a hospital setting. It'll be a home where if you want to go visit someone, or that's where you want to live, you'll have your own space. There'll also be a community rec center area where people can go and have activities and do art and all of those types of things. So that's really where not only the Michigan Veterans Affairs Agency is heading, but that's really where the VA is heading, which is why they agreed to give us the funding to help out to build these homes. So 2 new homes are part of that plan to modernize and increase access to long-term care for veterans. Unfortunately, there are many times where there are waiting lists at the homes that we have right now. And so each state is allotted a certain amount of beds. And so we want to make sure that we fill those beds. I believe we're close to 700 that we can have statewide. And as we build these homes, so these homes will have about 138 homes per site is what we're looking at. So over the course of those 7, we'll make up that 700 homes. So just to give you a little bit of demographic information, as you probably have heard, or maybe you don't, we get these numbers from the VA numbers that they put out. The DOD has a different number of veterans that they believe are in the state of Michigan based on DD-214s and people that are getting out of the military. But if we go by the VA's demographics, we're close to 600,000 veterans in the state of Michigan, with 54% being 65 and older. We are the 11th largest state in the nation for veterans population. There's about 18% of Michigan veterans receive compensation and pension benefits. The states that are listed on different websites as being in the top 10 for states where veterans want to live, work, and retire have about 40% or more of their veterans who qualify for benefits receiving compensation and pension. So we're working to raise our number in the next, to increase that number, which means we increase that through outreach. We increase that number by education and awareness of the potential benefits that people have. We're looking to increase that to at least 25% in the next 3 years. So we have a lot of work to do, but I think it can be done. About 39% of Michigan veterans are enrolled in VA healthcare. So that's one of those things I look at not every single veteran qualifies for VA health care. And so I want to make sure that as an agency, we're not only looking at those veterans who qualify for VA health care and raising that education and awareness that they can be enrolled in VA health care, but also looking at other types of avenues for veterans to get health care benefits that maybe come from the private sector. So this is the challenge is, where do veterans turn for assistance? Now, I can honestly tell you, when I looked at this, I felt like I needed to take a Xanax, because I don't know if anybody else feels like, how am I following these lines? But that is kind of the mind map that a veteran is facing when we have so many different resources out there. I mean, there's so many different resources. There's resources for housing, education, employment, lawn care, you name it. There's a resource that can help a veteran, a disabled veteran. However, you ask a veteran to, oh yeah, there's resources out there. This is what they have to navigate to find it. And it can be very frustrating. And so then they just throw their hands up and say, I'm not going to get that benefit. So what our solution is as MVAA is to have that, to be that resource hub. That's why we were stood up to be the central coordinating agency for veterans benefits and resources. So we are working hard to not only partner and collaborate with state agencies, but also local organizations as well, to make sure that we are providing those resources. If a veteran calls our hotline number, which I'll get to that in a little bit, but if they call our number, they can be connected to any benefit resource from that one number. So we're trying to connect them. We do DD-214 retrieval. So I know our team, I felt so bad for them. They just went down to Detroit a couple of days ago to bring back archives of old DD-214s that they now have to log into the system, so that if somebody calls in, I said, good luck with that. So that if somebody calls in for their DD-214 and they served in Vietnam, or they served, or a family member and they served in World War II, that they can contact us and we can get that DD-214 for them. We have access to DPERS, so we can pull those DD-214s. And a lot of times when we go to events, not today, sorry, but when we go to events, we have a team on hand that can actually print those DD-214s right there for you. So that's a really good benefit. You can contact us, or you can go on our website and put in your information, and you can get your DD-214 much quicker than waiting for the National Personnel Records. So we also connect them to VA benefits, to DHHS, Medicaid, Medicare information. We connect them to our Michigan Veterans Trust Fund. How many of you have heard of the Michigan Veterans Trust Fund, by show of hands? Oh my gosh, wow. I expected that number to be higher. So we have this unique trust fund that is in statute. It's a constitutional law that we help wartime veterans, war era veterans with emergency assistance. So those emergent needs are not, I need assistance with my rent because I can't pay my rent next month. Those emergent needs may be, I have a job or I have income, but my car broke down. That was not something I was planning on. It wasn't something I was looking forward to. I can afford my bills, but this was a unique situation that kind of intervened. And so the Michigan Trust Fund can handle that. They've awarded from $100 to, I believe, $50,000 to veterans for emergent needs. So that is also a way that you can get linked to the Michigan Veterans Trust Fund, is through our agency. And that's where the Veterans Trust Fund is housed. And there's also a board that meets to determine those emergent needs. So we also have veteran service officers that we hire. That we have 5 of them, and I'm going to get to that in a second. We have 5 veteran service officers that we employ. They've brought in close to $14 million this year of benefits to the state through their advocacy. So if 5 can do that, I know you can imagine what the numbers of the other veteran service officers that we work with are bringing in. But there are still so many veterans who don't know about the benefits they qualify for. So that's why it's important for us to make sure that we're there. Our approach to everything is that there's no wrong door. So that's our service model. When we're looking at helping veterans with employment or education or healthcare or even quality of life, like even recreational activities that are out there and available to veterans, we're open to looking at any organization or entity that's providing for veterans. We're even looking at trying to create a program where we help train and provide guidance to nonprofit organizations who are looking to serve veterans, because it's really important that we don't have nonprofits out there taking advantage of veterans. And so, and sometimes they're taking advantage of them knowingly and sometimes unknowingly. So to be able to educate people who either have started one and still need some guidance, or who have not started one and want to give them guidance on best practices for running a nonprofit successfully, and them learning about the demographics and dynamics that veterans face is going to be important. So we're looking at doing that as well. So we work with community and non-VA healthcare providers to raise that awareness of the unique needs. Like I said, part of my campaign is outreach. We've done a really great job as an agency of reaching employers and reaching educators and reaching certain entities. What we need to focus now more than ever on is reaching the veteran, because not that I don't trust what everybody's doing, but I don't know who's reaching the veterans if I'm not getting that information. And so I know that if I have a mission to reach those veterans, that we will be reaching the veterans. And so that is my ultimate goal for our agency, is to make sure that we are putting that information in the hands of veterans so that they have all the tools that they need to be successful. We also support statewide prevention efforts. We host different events and collaboration with other organizations to not only raise awareness of prevention techniques, but also to provide any training or information on just best practices within the realm of veterans on health and wellness and those things to help them in their mission for suicide prevention. We also have some really great veteran justice initiatives. Just by show of hands, has anybody ever heard of our incarcerated veterans program? All right, okay, a couple. We have this unique incarcerated veterans program that we run. We were an Abraham Lincoln Pillar Award winner from the VA and the National State Directors Organization for this innovative approach that we have, and many states are trying to jump on board and figure out how we're doing this, but we just have a really great relationship with the Saginaw VA here to be able to accomplish this. So what we do is that we know that veterans can actually receive a portion of their benefits while they're incarcerated. And so we worked with Saginaw Correctional Facility and the Saginaw VA facility in order to create this program. What this program does is there's a section of Saginaw facility that houses up to 240 male veterans. And in that place, I mean, it's amazing. I went to go see the facility, and they have their own code of conduct. They haven't had any incidents in that area, that wing of the prison, because they are running themselves like a military, like they're policing each other, which is really great. So that was maybe not necessarily an intended consequence, but it was a positive one for sure. But what we do is that we work with veteran service officers. We have veteran service officers that go into the prison and meet with these veterans. They come from all of the different prisons within the state of Michigan to come there to get their benefit processing. And then if they're honorably discharged or they qualify for VA compensation and pension, once they're granted it, they can get 10% of that. The 10% rating can go to them while they're in prison. The rest of it, their families can actually petition to get that money. So that's what's important about it, is that the family doesn't necessarily have to suffer while that veteran's incarcerated. If there's a disability, then the family can petition for the portion that they're not getting. So that's what's unique about it. And then as they're about to transition out of prison, then we provide them with all these different supports, employment, housing resources, all of those things, so that they don't we can lower that recidivism rate. So I can say that out of the 13 that have been released, only one, and I'm very disappointed in him, but only one has had a probation violation that has gone back. So I think that's pretty successful, considering these men are in for a long time. Now, you might ask about the women. We do have a smaller program. I think it's about 40 women in Huron Valley. It's just not as robust. And the reason why we had to really work with the VA is because they have to be willing to accept the disability questionnaires as part of the process instead of going to an exam. And if an exam is absolutely needed, as you know, the veteran can't just go to the facility, right? They have to go with an armed guard. And so that armed guard's coming to the VA. So the Saginaw VA had to really be willing to allow an armed guard entourage to be able to come in with this veteran to get those exams as needed. So that's really important. And we actually just finished up 5 years of this program, and we're about to sign our memorandum of understanding again to up this program again. So it's very exciting what we're doing in that area to not only help the veteran, because I understand they did something and they're in prison, but we're also trying to help the families in that way. We're also supporting our underserved and vulnerable veteran populations, which include women veterans and homeless veterans. As you may know or may not know, there's about 44,000 women veterans in the state of Michigan, and a lot of them don't self-identify. So we're working to build a women veterans division within the Michigan Veterans Affairs Agency to make sure that we're addressing those issues. And also, part of our strategy is to make sure that veterans want to live in Michigan. So we're doing that on all scales, not just with women and homeless veterans, but working that as well. So our goal is to become the top third state for veterans receiving VA benefits. And so that's gonna require some work with the federal VA to make sure that we aren't still like 50th or 51st in the nation for compensation and pension benefits, we were somewhere between 48 and 51, which is that's pretty low. We are also looking to increase, like I said, the number of veterans that are connected to those benefits, and then develop more education and employment opportunities for Michigan veterans. So what that means is working to get more schools and even apprenticeship and vocational programs GI Bill funded. So that's another thing that we're working on. So as I stated, we have veteran service officers, and I guess we have 6 now. I thought we had 5, but we have 6. And then we also work with county veterans counselors, and we have 138 of those accredited in 73 counties. We offer 2 accreditation trainings. So if any of you all ever wanted to come, they're free. You can come to an accreditation training and learn all about VA benefits. Maybe you don't become accredited, but you can become more aware of the things that you can do to help even with your own claim. So that's a really good training. We also have our Michigan Veterans Coalition, which has 66 veteran service officers, which are spread across, I believe it's 5 veteran service organizations: American Legion, the Disabled American Veterans, VFW, I think it's Purple Heart Veterans, and there's one more I can't think of off the top of my head, but that's where they are. We also have this is another unique thing that started in Michigan, is that we've separated our state into 10 prosperity regions. So we have 10 prosperity regions, and in essence, we have 10 regional coordinators, which work with veteran community action teams, which are made up of nonprofits, to deliver services and advocacy to veterans in those regions. So our regional coordinator works in collaboration with our state agency, as well as local government, state government. They even sometimes work with federal congressmen to make sure that those regions are getting the supports that they need. We're looking to see how we can increase the number of regional coordinators in each region, because as you can see, the UP has 1. That's a big stretch. I think that's where most of our travel reimbursement costs come from, is Region 1, because they're traveling a lot across that area, and it's a wide, vast area. So we're looking to increase more regional coordinators in those areas to connect veterans to those benefits that they need. So I talked about our Resource Service Center. That was another Pillar Award winner, first in the country to create this Veteran Resource Service Center. So we have this 1-800-MISHVET number that if you were to call that number and you needed resources, we could connect you to all the resources that we have at our fingertips, plus more. So that's where you can get your referral for your application for emergency assistance. If you need information on your DD-214 retrieval, if you need information on how to get connected with DHHS, we have a connection that's right to the DHHS department that you need to get to. Just all those different resources that you may call in and say you need some help. You may need mental health support. You may need somebody to help you with your claim. You may need any of those types of services. Maybe you want more information on how you can get enrolled or admitted to a veteran's home. So all of that is available at 1-800-MISHVET, and we also have a website, michiganveterans.com, where you can go as well and see all the benefits and things that we offer, and actually see which regional coordinator is in your region. So we are down to Region 7 and Region 10. We have to refill those positions, but If you contact us for anything, we will make sure that we get you connected. There is not a vacancy opening right now because we are trying to reduce so that we can start to spread some of those people over to the new home. So we're not taking a lot of new admissions right now, but we will be taking them soon. We have the accredited counselor training that you can receive. You can actually go to our 1-800-MISHVET. You can either go to michiganveterans.gov and send us an email, or you can contact 1-800-MISHVET and ask when the next training is.